Well, I'm really pleased, and people will be celebrating across our country that life is starting to return back to normal after a pretty dismal 18 months, particularly in the north where we've seen record infection rates. We've in fact been in restrictions longer than any other area of the country. And I think now is the right time, as the Prime Minister said, to unlock, because frankly, if we don't do it now, while traditionally respiratory diseases are a lot lighter and less strain on our NHS in the summer, then I suppose we have to question, if not now, then when? And I support these rollbacks.
Even if hospitalisations are increasing sharply in some places, as they are?
Well, they are increasing sharply in some cases, but I think we need to look at the figures really starkly. There are over 1,000 people every single day in the United Kingdom who die from all diseases, tragically. And the last day for which we know the data, there was 9 people who tragically lost their lives to COVID. I don't belittle that in any way, and it's a huge tragedy for each and every single one of those families. But things like cancer, heart disease, that unseen crisis that is about to hit our NHS because of the restrictions we've had on it because of COVID, far greater numbers of people are perishing because of that.
Kate Bell, isn't the issue, as the Prime Minister said, Jake Berry just echoing him, if not now, when we need to get the economy back on its feet?
Well, everybody is desperate to get back to normal, and, our place to judge the epidemiological evidence. But I think what we are worried about is this kind of go your own way approach is a potential recipe for confusion in workplaces. And of course, many public places where people are now going to be making their own decisions about whether to wear masks, for example, are also workplaces. So I think we need really clear guidance for workers, for example, in public transport, for workers in retail, many of them young workers, about what they can expect to have their safety protected and to make sure that, those people who've worked right throughout the pandemic continue to have their safety respected and continue to have a voice in those decisions.
There will be guidance, though. The Prime Minister made that clear. But isn't it time to trust employers and employees?
Well, what we want to see is that guidance consulted on. We are pleased to see that the Prime Minister did suggest there would be some workplace safety guidance, but unfortunately there's been a tendency to announce first and consult later. So what we're hoping is the Prime Minister, ministers will now get employers, unions around the table to say, what's that guidance need to look like? And also, what can people expect when they do work in a public place? How can we make sure that they're also safe at work?
Jake Berry, will you be ripping your mask off on July the 19th?
Well, I certainly won't be wearing one on July the 19th, except in some circumstances. If I'm travelling on the tube in London or in a busy railway carriage, I personally will choose to continue to wear a mask. So that's a personal choice, which I'm more than capable of making. And of course, all workplaces are public places, unless you happen to work on your own, but the vast majority of them are public places. And we have to trust people to make the right decision. I mean, we're all perfectly capable of looking at the data that is available and making our own risk-based assessments. I don't need to be told by the government or, in fact, anyone else when I should be wearing a mask. I'm perfectly capable of making that decision myself, and I trust the British people to do likewise.
Kate Bell?
Well, I think, workplaces are places where we make decisions collectively. The best way to make those decisions, and that's much easier when we have a shared set of information. So clear guidance from the government about what they believe to be safe will help people come to the right decision and help them to come to the right decision without conflict and in a way where, again, workers and employers can make those decisions together.
Jake Berry, I mean, you risk letting unscrupulous employers exploit employees who don't feel they can stand up and say, actually, people aren't wearing masks, this is unsafe. It's a problem, isn't it?
It's a personal decision, isn't it, for each of those individuals, whether they wear a mask or not. I mean, I just say, I do think we, in society now, for far too long, have had the government making all the decisions for us. It is time that is rolled back. We live in a free and open society. People should be free to make their own risk assessments. I don't need the government to tell me how I should behave and whether I should wear a mask or not. I absolutely understand the point that employees, particularly in public places, brilliant public servants who kept all the services going during this pandemic, will want some clarity and guidance, and it's for the employers, in consultation with the employees, to set what is the appropriate measures for their area. The government does not know whether people riding a bus in the centre of Rawtenstall should or should not be wearing a mask. It is much better for the bus company and the drivers and the passengers to decide for themselves.
Kate Bell, is it time to get the state to just step back in terms of all, telling us what to do and when, and, for example, get people back into workplaces to revive city centres?
Well, I think the problem is that one person's personal decision is another person's health and safety risk. Of course, we want to see people back in workplaces, and many people have been in workplaces throughout this pandemic. We want to see, economic recovery encouraged and people back at work. But it's not just kind of guidance we need for that. We also need the right protections in place. A huge missing part of this announcement today was any support for sick pay. We've still got people being asked to self-isolate, and the government guidance is very clear that people should stay at home when they're ill without being able to do that. People being forced into debt by the lack of sick pay is also having a hugely damaging impact on our city centres. And that's a problem we really need to fix.
I mean, there is a £500 test and trace payment, isn't there?
Yes, but our research has found that many people don't know about that, and also many people who've applied for that are not eligible for it. We've got a really simple system. It's called sick pay. It should be available to everybody. It should be paid at a higher rate, and that's one of the most important steps we could have taken today in order to prevent the spread of the pandemic and also protect people's financial well-being.
Jake Berry, that's one reason why cases are soaring, isn't it? That the right financial support is still, at this stage in the pandemic, not in place.
Well, I'm not sure I accept that. I mean, if there is that £500 payment, and maybe it's a job of politicians like me and the TUC to make sure that people know more about that and can get out and claim it. I think the reason cases are going up is because in many areas of the country, people are actually ahead of where the government is in terms of this relaxation, or are starting to go about their normal lives. That's a dangerous position for us to be in, and that's why it's right. The government slightly playing catch up is going to come out with clear guidance and empower people to make their own personal decisions about keeping themselves, their family and the people around them safe.
And is there an acceptable level of deaths when it comes to, you're talking about risk and you're talking about personal decisions, is there an acceptable level of deaths akin to, say, 20,000 annual flu deaths?
Well, it's quite interesting. In your report earlier, they were saying the government's been quite tight-lipped about that. I will share an unsurprising fact that they haven't told me what they think it is. But clearly every single year in this country, there are between 10 and 20,000 flu deaths. We do not shut down our economy. We do not stop people going to work. We do not close down our hospitality industry. If the government's made a decision that that's about the right sort of number, I don't know if they have. They haven't told me. But it seems to me that we deal with flu every year, and we've got to learn to live with COVID.
So would that be acceptable, that scale of death?
Well, it's not a decision for me to make. I don't have the data to tell you what decision the government's made about the acceptable level and where this relaxation will leave us. But I do say that as a nation, we have to accept that COVID isn't going away. We all have to go about our normal lives. We have to try and restart our economy while keeping our family and friends and people